All right. So we're going to talk about obesity and its impact on occupational performance. Now, this is a condition, a clinical condition, that you will see intermingled with many, many other clinical conditions across the spectrum: age, gender, race, ethnicity, background, socioeconomic status, all of the things. You'll see this one intermingled. And I feel very passionate, I guess is the word, about this particular subject because there is such a bias related to obesity and the terms and the actions and everything related to people who are obese. There is a stigma. They are oftentimes healthcare professionals do not there's a fear, there's a preconceived notions, again, going back to bias, as we've talked about. So I need you to be very mindful when working with people who have a diagnosis of obesity. Be mindful of your language, be mindful of your face, our faces. You know, I can't hide anything on my face. They give us away. Be mindful of how we interact. Because this clientele oftentimes gets overlooked because of this bias and fear and stigma related to obesity. So, in terms of language and words, this is the bariatric population. So bariatric is the term used for someone who is of 250 pounds, I believe, or greater. They're bariatric. And these clients require specialized equipment to sustain the weight. So adaptive equipment or durable medical equipment such as commodes, tub benches, shower chairs, beds, patient lifts, client lifts, like manual electric lifts. They all have a certain weight limit, and for somebody who is of 250 pounds or higher, they need to be bariatric. So, but with this clientele, again, there's other conditions that will contribute to obesity: diabetes, mental health conditions. Let's go back to orthopedic injuries and maybe their recovery from, let's say, a multi-trauma resulted in chronic pain and anxiety, and which then resulted in not moving as much, and then obesity happens. So some things for us to be aware of when we're working with these clients is always be mindful of your body. And if you're working with somebody who requires extra assistance, be sure to be mindful of your body and be safe with your body mechanics, and appropriately ask for help. Don't assume that the client can't do anything based on our bias. We see a certain weight and we see what they look like, and we're like, oh, I'm going to need like 4 people to get this person out of bed. We always go in with an open mind and we ask, are you able to do X, Y, and Z? And we give them the opportunity to do the activity that we want them to do, versus just bringing in a whole load of people and like moving them around and like trying to get them out of bed or whatever it is. So always ask first, but on the flip side of that, be mindful of your body and get help if you need it. Now, if you do need to help, like if you've asked them to, let's say, roll, and rolling is really hard for them and you need a second set of hands, and you've gotten that second set of hands, be very aware of your body language and the things that how you are directing the care, how you're directing your second set of hands. There is never a need to grunt or groan when helping somebody roll, especially with somebody who is bariatric. So just be kind and thoughtful when you're working with this population, because like I said, they are often highly discriminated against because of their size. And because of all of that, there could be impairments with their skin integrity. So when it comes to ADLs, activities of daily living, obesity might impact that skin integrity. So underneath skin folds, there might be skin breakdown. So we always want to make sure you're doing skin checks or educating them on how to do skin checks, how to appropriately clean and dry and use powder appropriately, not like dousing themselves in powder, but, you know, how to keep the areas from getting moist, and then moisture leads to skin breakdown. Along with that diminished skin integrity, bathing and hygiene, those go hand in hand as well. So if they're not able to effectively bathe and clean underneath their skin folds, then that's where the moisture lives, and that's where skin breakdown can happen, infections can happen. So be mindful of that. Hygiene in terms of cleaning their bottom, their peri area. Odors can occur. So just if it's educating them on how to appropriately clean with adaptive equipment, grade, adapt, modify, using adaptive equipment like a long-handled toilet hygiene aid, bathing, providing them with strategies for bathing, long-handled bathing item, adaptive equipment, or a shower chair, making those recommendations. So those are how occupational performance could be impacted, and then how we as the OT can help with that. Obesity can certainly impact ambulation. So if you can just, you just are imagining the cycle where for whatever reason they are obese, ambulation becomes challenging, they're not able to move, they're not able to get an effective level of physical activity that allows them to engage in any sort of exercise program, and the cycle continues and continues. Because of, potentially because of their, the obesity, they may not be able to engage in leisure activities. So going back to decreased ambulation, not able to get in and out of a vehicle because of their size and their weight and, whatever that is, and being able to engage in the things that they love to do, and then social participation. So all of those activities are impacted. Employment. If they're not able to ambulate, they're not able to get into a car or a bus or the train, and they're not able to successfully do work. Perhaps they work from home, and that's great. So you might be looking at home setup, ergonomics. Do they have the appropriate chair, the appropriate setup for whatever it is that they need? So those are all things as the OT that we're always thinking about, and how occupational performance could be impacted. Childhood obesity is on the rise. So again, that's the self-esteem, self-image, and then the child's ability to participate and play with their peers. So social participation is an ADL, is an occupation. So this is an area that we as the OT might address, and also an occupation that could be impacted. Ability to engage in household chores and pet care. So you can see how obesity as a whole can impact a person's ability to engage and participate effectively in their desired occupation. So as the therapist, we are going to devise a plan so that we can facilitate their effective engagement. Now, oftentimes you're not going to be seeing somebody specifically because of their diagnosis of obesity, but you might be seeing them because they've had a hip replacement, because they've had a fall, because they've had some sort of traumatic, a fall, a multi-trauma. So those conditions that you've learned about last week, you're now seeing how they're starting to interplay with each other. So if you have any questions, oh, I'm so sorry, don't hesitate to reach out, and I will talk with you all soon.